Yes,
I'll
please.
sit next to you.
Yes, and great
Well,
to have you
it's,
back.
Yeah, good to be back.
It's nice to follow the evolution of a company, you know? You hear like a snapshot sometimes, but like Deposit Solutions or BlaBlaCar or Flixbus, all these like great European companies like KRY, it's very nice to keep up to date.
It's actually KRY.
Sorry?
It's
KRY?
actually KRY. I know it's impossible to pronounce, but it's the same
it a
for being
Swedish- is it Swedish
So,
thing? What
so
does
it's
it
the same
mean?
for being healthy in Swedish.
KRY?
But that's why we go under the name Livy here in the UK and in France, because it's a bit hard to pronounce it.
Well, it's easy to remember.
True, it's easy to remember.
So what happened in the last year since we last met? Are you happy with the development? Is it going fast enough, or are you a typical impatient entrepreneur?
Well, you're fairly impatient, right? So no, it's still a lot of Europeans that we do not help, but we're now helping more and more Europeans. So in one way, of course, we are impatient.
You started in Sweden, no?
We started in Sweden. We launched in Sweden in 2015, and then obviously a lot of things have happened since we launched. Now we serve patients in Sweden and in Norway. We're extending our NHS offering here in the UK, so we now have around 2.5 million people covered with our NHS offering, meaning we provide
How many?
2.5 million.
2.5 million. This is just Sweden?
No, in the UK. So
UK,
in Sweden we have full coverage, meaning like
So
it's
Sweden
available.
is done, check mark, and you're venturing now to.
Well,
the
I don't
other-
think we will ever
Not
be done.
of course. but-
Right, it's
What
a big space.
What did make you start this app?
Out of my own frustration. I'm a patient myself, and seeing the pain points in healthcare, and I wanted to change it. We started to dig into it, and we soon realized there were no regulatory blockers in Sweden.
In Sweden.
Yeah, very different story in other markets.
how
But now
can
that's
that-
rapidly are changing.
Right.
And then no one was doing it, and we said that we need to do it, and we started to build a team, and then we launched the first version of the service in Sweden in 2015, and yeah, since then a lot of things have happened.
And in countries like Germany, I think it's not allowed yet to do distant medicine, right?
Well, it is. I guess that we have quite a lot of Germans
Smava, yeah. Not
here.
Smava, sorry.
Well, Germany is very exciting, I think. I'm very bullish about Germany. You have a very progressive Minister of Health with Jens Spahn, who understands that this is a part of the future, and so I think we will have a lot of.
So why do we need your app, right? I mean, we all have our favorite doctors. I mean, what problem you really solve? Is it you're giving medicine or healthcare to people who are not able to go to the doctor because they're...
Yeah. So you do have, like, if you look into European healthcare and European primary care, because that's our main focus, you have an access problem. You have high quality of care, but there's a lack of access in many markets, meaning it's hard to
find a doctor at all, or find the right doctor?
It's hard to get a doctor quickly, right?
Yeah.
And what you have in most European markets is that since you have a lack of access in the first layer of defense in primary care, you also have a spillover effect to emergency rooms and urgent care clinics and so on. And that's fairly costly to produce healthcare in emergency rooms when you can do it at a GP practice. And what we bring from the patient side is, of course, that we bring a lot of access. So with our service, you pretty much have instant access. So if I want to see a doctor or a psychologist or a nurse, I can have one calling me via video in a matter of minutes, 24/7, all days a year.
And who pays for that? The insurer, or you pay yourself?
So it's a bit different between the different markets, but this obviously also solves a big problem for the payers of healthcare. And the main payer in Europe is the public, right? So in Sweden and in other markets here as well, we act in public-private partnerships. So we deliver NHS services here, and we deliver public services in Sweden as well, but as a private company.
So in Sweden, where you are operating the distant health product, how do we need to envision that? You are like on a FaceTime with a doctor, and you show your body parts who need some examination, or how does that work?
If you're in need of help, you start by downloading our application, iOS or Android, and then you start by answering a few questions around your symptoms, and based on those questions, you get in real-time match to the right type of clinician, and that could in some cases be a nurse, in many cases it's a doctor, it could also be a psychologist. So in Sweden
And they're vetted by your platform.
Exactly. So
they're
we
not
have,
the ones who are like needy and greedy, the doctors who are like so bad they don't get patients in the offline world, I hope.
No, so we at core we are a tech and product company, but we also operate healthcare ourselves. So we have local entities in
you have
all
your own
markets.
content also.
Yeah, so it's a controlled platform.
Yeah.
So we employ our own local clinicians in all those different
So
markets.
you're not
with
dependent
all,
on any Uber driver, so to say.
And no, but we do have a lot of clinicians on staff.
Okay.
And then we do all the compliance work and quality assurance locally. So we have local medical directors and
So you're a bit like our education company we had earlier, which is like an online university. It's very large. They do over 100 million revenues. So you are actually providing healthcare services. You're not lead genning anything or connecting.
Not at all, no.
You're like a healthcare provider.
Yeah, we are a healthcare
proper.
provider, like a
It's very different
tech-enabled
to
healthcare provider.
all the other providers, no?
But as I said, at core we're a tech and product company, but we realized fairly early that we also need to roll up our sleeves and go deep and actually operate a lot of the healthcare that we do ourselves. So that's what we do. And that's a fair amount of complexity involved with doing that, but that's a big part to our success so far, that we are controlling the quality of the services that we do and provide. And it's also very clear to me that you can't solve one of the big problems in healthcare by just adding a layer of digital on top of the existing system. You actually have to go deep and operate a lot of it ourselves. So that's what we do. In the majority, we operate ourselves with our own clinicians, yes. And I say clinicians because we don't only have doctors, so we have nurses.
So since you're very cost efficient, there's no real estate needed, no transportation, etc. So you're, I mean, at some point, I guess, but you must save a lot of money for the public with your model.
Yeah, we are. Obviously, we're solving problems for all the different stakeholders. We're solving the problem for the patients because you have instant access. You don't have to travel long distances. You don't have to sit in a waiting room. You're solving a big problem for the clinicians because they can, with our great tools that we've built, they can produce more and better healthcare, and they can also be more flexible. And you're solving a big and a real problem for the payers. That looking into governments or markets in Europe, you have an elderly population, you have healthcare expenditure going up, but your access going down. And you have, in France, for example, they tend to talk quite a lot about what they're called medical deserts, meaning big areas where you have limited or no access at all. And we help solve that.
Nice. And then if you think about Dr. Lib or Doc Planner, which are the ones scheduling the meetings, I think their vision is at some point to connect through telemedicine the doctors and the patient. This would go in the model where you actually have like an Uber type of concept, right? Is the regulation ready for that in Europe? Do you think it will open up?
I think that the regulations are starting to be ready. I think that Sweden is a bit ahead.
But in the European Union, the regulations starting to be ready, it could be another 15 years, no?
No, I think what we see a lot of policy tailwinds and changes now. So you have here in the UK, you have the NHS long-term plan that's clearly stating that this is the direction moving forward. You have, in Germany, you have Jens Spahn pushing in the right direction. You have Sweden is ahead in many ways. Where we are at scale in Sweden, and it's been around.
So Sweden and the UK so far, not other markets mostly.
We are launched in Sweden and in Norway, here in the UK, and in France. Yeah.
And in France.
Yeah.
And what are your growth plans? I mean, obviously, you're a content business as such because you are providing advice. You must be based on content, on knowledge. Do we have to think about disease categories that you add more and more expertise covering any health condition, or how do you grow?
We're constantly deepening the existing product by sort of adding more symptoms, and we do home tests. We do we don't only do doctors, we do psychologists. We're running the largest psychology practice in Sweden. Digitally.
Is psychology, I mean,
so mental health is also, so obviously we are constantly improving the offering and going deeper and broader, and then we also keep covering more markets.
So you have also very nice data coming out of it then, right? You can.
Yeah, we have, and we also use the data. So in healthcare today, you do have a lot of data that's floating around in different systems, and no one is really using it. And we are actually using the data to improve the quality of care that we do and to provide a better and stronger services to the patients.
And the regulator is turning to you now, you told me backstage, right? They're asking you, for regulation and help? Because it's really complex, and if you're not an expert on digital medicine and regulation, you're probably missing quite a lot, no?
It is fairly complex. In many ways, it is. And then at core, we're solving the same problem as the local GP offices have been solving, but we're doing it in a new and a more efficient way, right?
Are they trying to lobby against you, the practitioners?
Well,
Or
I think you will always have, in big changes, you will always have people and entities that have a vested interest in making sure things do not change. But what we're starting to have, when you look into Europe, you have people understand that this is an important part of the future, and we're very ready to deliver on that.
Well, I'm always on the run, and when I have some ouchies, my God, it's a problem. I usually go to some airport doctor, and it's
but the thing is, like, no one, and I had the experience as well, and we are all patients, right? And it's as said, the quality of healthcare is fairly high, but access is not really there. You have to, like in Sweden, you literally have to call a landline early in the morning. You have to try to get an appointment. You maybe get it
through grumpy waiting room. Usually.
Exactly. No one likes to sit in that waiting room, and in most cases, it's not needed. You don't have to. You could actually use our service instead, and that replaces.
So you have like a pre-screening activity, and then you get referred to a.
Yeah, exactly. So you start by answering a few questions.
But then you don't make money. How do you make money exactly?
As most other healthcare providers, we deliver healthcare.
So you just charge per minute, or?
No, we usually don't charge per minute, and we are payer agnostic. So in some cases, we go directly to consumers and they pay for it. But in many cases, we do partnerships with the public. So here, as I said, we deliver NHS services here. So we're partnering with NHS to deliver NHS services, and we do the same in Sweden, where we partner with the public payer to make sure it's something for everyone. And I think that's our aim. Our aim is to make sure that this is something for everyone.
Yes, and giving health advice sounds as sensitive as giving financial advice. Are you regulated yourself as a?
Yeah, very much so. In all markets that we have entered, we
Was it difficult to get regulated for that activities?
Well, it's work. It's a lot of work involved, but it's not unsolvable, right? So it's and yeah, of course, it's a lot of work involved by operating the services ourselves, and it's different regulations in different markets, but there's a lot of similarities as well, and how we deliver healthcare is the same, right? And the product is more or less the same.
You have with Index and Axel, two of the most prominent European VCs. You raised 79 million euros. Would further capital help you to accelerate the growth?
Yeah, we're not in need of more capital here and now, but yeah, it would. I think it's for us. We will continue to invest in building a stronger and broader product, and we'll continue to invest in making sure we're not only helping patients in the markets that we're currently in, but also helping patients across.
Who's your largest competitor?
Well, status quo in many ways, I think. I think it's also a very big space, right? So healthcare is 10-11% of GDP in all European Western nations. So I think that's also when you're starting to look into it, it's not a resource issue really. Like it's a lot of resources within healthcare. It's a lot of money going into the system.
It's also the mass market being ready for it, huh?
Sorry?
It's a mass market being ready for it, huh?
Yeah, now you start consumer readiness is there.
I think that's phenomena. Once everyone does it, some.
Yeah, but I think that probably people here in this room, from a patient's perspective, I think most people are ready for it. Like we are ready to
I'm not ready for it at all. I don't want to get sick.
No, hopefully you can try to avoid it. But when you are, I think that you probably are fairly ready for it. And what you're starting to have now is that you have the mega payers of the world, that is like the European governments, also starting to be ready for it, and you're starting to have healthcare professionals being ready for it and understand that this is a very important and very needed part of the future.
I like very much the accessibility argument, because digital is actually exactly solving that. And you're a pioneer here. It's amazing.
Yeah, and we can match in real time, and we build a lot of great products for the clinicians to make better and decisions, and we can quality assure in real time and so on. So it's a lot of fun.
Oh, healthcare is so interesting. I couldn't stop talking.
Yeah.
I think we have a few more interesting healthcare companies. We have Sava now from Germany. Thank you, Johannes. Very nice talk.